Good morning, good afternoon, and welcome everyone to the Pan American Health Organization virtual event to launch PAHOLA, PAHO's digital health specialist on alcohol use. I'm Silvana Luciani from the PAHO NCD program, who's moderating this very lively and engaging discussion on the use of artificial intelligence for alcohol reduction and misinformation on alcohol risks to health. We're pleased to have you here joining us today, and this session is going to be transmitted in English, Spanish, and Portuguese. So for those who would like to hear the session in their own language, English, Spanish, or Portuguese, please click on the icon at the bottom of the screen on interpretation. And for those of you who are just connecting for the first time to a Pan American Health Organization webinar, we'd like to just let you know that we are an international technical cooperation agency working for over 120 years with ministries of health and other partner organizations in the Americas on a range of public health matters. And for non-communicable diseases, including alcohol reduction, the program has been about 20 years in the making. So today we're really thrilled to be able to unveil PAHOLA, which is the only artificial intelligence digital health worker in the world that focuses on alcohol-related topics. And we're especially thrilled to be doing this together with all of you, together with the leaders of the Pan American Health Organization, the Director General of the World Health Organization, along with experts in public health and alcohol. And the timing couldn't have been better because just last week, we at PAHO launched a public education campaign called Live Better, Drink Less to educate and inform about the risks of alcohol to health. So to open our meeting, I'd like to introduce Dr. Anselm Hennis, who is the Director of the Non-Communicable Diseases and Mental Health Program at PAHO, who oversees the organization's technical cooperation work on alcohol as well as other NCD risk factors and the NCD program overall. So thank you, Dr. Hennis, for joining us today, and over to you.
Thank you so much, Silvana. Good morning, good afternoon, and good evening to all joining us today from across the globe. My name is Anselm Hennis, and I'm the Director of the Department of Non-Communicable Diseases and Mental Health at the Pan American Health Organization. I would like to welcome our distinguished guests and panelists, esteemed delegates of the Pan American Health Organization member states and colleagues and partners to today's seminal launch of PAHOLA, the world's first digital health specialist on alcohol use. We are honored to be joined today by Dr. Tedros Adhanom Ghebreyesus, Director General of WHO, and Dr. Jarbas Barbosa, Assistant Director of PAHO, participating on behalf of our Director, Dr. Carissa Etienne, who regrettably could not be with us today. In a region profoundly impacted by the health and social consequences of alcohol use, which have been further exacerbated by the ongoing COVID-19 pandemic, PAHOLA brings us closer to achieving our vision of a region where all people affected by alcohol use have access to affordable, equitable, and quality services and support, free from stigma and discrimination. PAHOLA is the result of the extraordinary efforts and fruitful collaboration of many remarkable people across PAHO and the WHO, as well as our external partners at the WHO collaborating centers and Rooftop and Soul Machines, about whom we hear more later. Today, we will hear from experts in the fields of public health, alcohol, and artificial intelligence, who will be introducing us to the capabilities of our new digital health specialists and walking us through this inspiring and innovative public health initiative. Welcome to one and all.
Thank you, Dr. Hennis, for opening up our meeting and for your support for the PAHOLA Digital Health Specialist on alcohol use. And we at PAHO are very fortunate to have senior leadership that's so supportive of our innovations and strategies to address the burden of alcohol in the Americas region. And today, to welcome us, we have Dr. Jarbas Barbosa, PAHO's Assistant Director, who's going to provide his remarks on this app. Over to you.
Thank you, Silvana. Good morning, good afternoon, good evening, and thank you very much for joining us for this exciting event. Now I can see that you have more than 300 participants, so I think that it got a lot of attention in many countries in our region. On behalf of our director, Dr. Carissa Etienne, it's my great pleasure to introduce you to one of PAHO's most innovative projects, PAHOLA. Paola is a digital public health worker created to provide reliable information on alcohol and its impact on health, to assess risks related to alcohol consumption, and to help those who are ready to reduce their alcohol use, find additional support, and learn how to make healthier choices in their daily lives. Paola is the first digital health specialist on alcohol use in the world, and she is the result of a combination of powerful technologies such as artificial intelligence and machine learning, supported by healthcare, psychological, and educational interventions. Paola was built using artificial intelligence, or AI, created by our partners at Soul Machines, and her information content was created here at PAHO, in collaboration with our partners at the Rooftop. This ongoing collaboration began almost a year ago, and we have worked closely to bring together cutting-edge technology and public health expertise to fill an important gap in alcohol-related knowledge and care. With the creation and launch of Paola, PAHO's goal is to help people across the Americas and globally to better understand the harms caused by alcohol consumption, to increase access to reliable information, to facilitate self-assessment of alcohol-related risks, and take concrete steps to reduce alcohol consumption. Alcohol causes a heavy toll on health and well-being in the Americas, leading to more than 379,000 deaths annually and the loss of nearly 19 million life years due to premature death or years lived with a disability due to physical or mental ill health. Alcohol also harms persons other than the consumer as a result of violence and injuries, such as those sustained in road crashes or due to interpersonal violence. Alcohol consumption has increased in several countries during the COVID-19 pandemic, and social norms around drinking have changed as well, aided by online marketing, sales, and home deliveries. These changes have also occurred at the same time that the treatment services have decreased as a result of pandemic-related disruptions to health services. Services for mental, neurological, and substance use disorders have been disproportionately affected, with a recent survey in the Americas showing that 60% of countries continue to experience disruptions to these essential health services. Much more needs to be done to reduce the harms associated with alcohol, from strengthening public policies to support individual interventions. Paola complements our existing and established efforts to support member states to implement cost-effective policies at the population level to reduce the harmful use of alcohol. Paola will be an important contribution to our efforts to build back better as we deal with the effects of the COVID-19 pandemic. Our health systems will benefit from innovative approaches to education and care like Paola, who will reach more people and provide real-time support that is not only convenient, but also empathetic and free of judgment. Paola will not replace contact with health professionals, but she can provide support to available services and encourage people to seek the help that they need. We are confident that Paola will improve the effectiveness of treatments for alcohol use disorders and contribute to reducing the treatment gap that currently exists. Paola will not have been possible without the inspiration provided by Florence, developed and launched by WHO over a year ago as a digital health worker for tobacco cessation. I would like to thank Soul Machine and Rooftop for their outstanding work, and the Department of Non-Communicable Diseases and Mental Health here at PAHO for their vision, creativity, and hard work in bringing Paola to fruition. Now it's an honor for me to present Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, who has recorded his remarks. Thank you.
Dear colleagues and friends, the COVID-19 pandemic has reminded all of us of the incredible value of health workers but it's also shown us how new technologies, including artificial intelligence, are powerful tools for expanding access to information and care. Last year, WHO introduced the world to Florence, a digital health worker to help people quit smoking. Now, we're proud to introduce her sister, PAHOLA, to help people assess their alcohol risk, cut down on their drinking, or seek treatment and recovery. Alcohol contributes to 3 million deaths globally each year, and to disabilities and poor physical and mental health for millions of people. It is the leading risk factor for premature mortality and disability among people aged between 15 and 49 years. So any tool that can help people to reduce their risk and lead a healthier life is welcome. I congratulate our colleagues at PAHO for this innovative tool, which I hope will be very successful in the Americas and around the world.
Excellent. Thank you very much, Dr. Barbosa and Dr. Tedros. If you're just joining, that was the Director General of the World Health Organization, Dr. Tedros, providing a video message that was preceded by welcoming remarks by Dr. Jarvis Barbosa, the Assistant Director of the Pan American Health Organization, providing their support and remarks on the launch of PAHOLA's digital health specialist on alcohol use. And as you heard, it's not meant to replace the support that one gets from health workers, but it's a tool to expand access to information and care. And in fact, artificial intelligence has become the new frontier in health, and particularly with AI that visually and audibly emulates a human being, the benefits have been well noted. And so let's find out for ourselves how this applies to alcohol. And this is the moment that with great enthusiasm and excitement, I introduce you to PAHOLA, who is the first digital health specialist on alcohol use and who can provide non-judgmental and reliable information to help people better understand the harms that are associated with alcohol and to decrease alcohol consumption. And she is available in English, Spanish, and Portuguese. So let's meet PAHOLA.
Hello, Paula.
Buenos días.
Bom dia.
Hola.
Oi.
Buenos dias.
Oi.
É um prazer te conhecer. O que você gostaria de falar hoje?
Beber álcool pode causar câncer?
Há uma forte ligação entre o álcool e as doenças crônicas, particularmente o câncer.
How can I make sure I drink responsibly?
I'm sorry to say, but there's no such thing as responsible drinking.
¿Cómo sé si estoy bebiendo demasiado?
Puedo ayudarte a evaluar si lo que bebes puede causarte daños.
Hi, I'm Paula. I'm the Pan American Health Organization's first digital health specialist on alcohol use. I was built to provide reliable information about the impact alcohol can have on your health. I can also help you check if your drinking is putting your health at risk and guide you through a plan to cut back. Do you think you could benefit from drinking less?
I know I would. Can you please help me?
I'd love to help you. And I promise I won't judge. I'm a digital person after all. I don't know how to judge.
Wow, I'm sure you will all agree with me when I say that Paula is very impressive in terms of the scope of her capability of providing information, but also in the convenience of having someone and somewhere to turn to get information about alcohol to help yourself or your family if you're concerned about this. And we're confident that Paula can help reduce alcohol consumption and improve health. And to talk to us more about this, we're going to turn now to our experts on alcohol and public health in this panel discussion on alcohol, public health, and artificial intelligence in healthcare. And I'm sure that many of you will have questions for them. So just to remind everybody to use the Q&A section at the bottom of the screen to ask your questions to the panel. And this panel is going to be moderated by Dr. Adam Karpati, who is the Senior Vice President of Public Health Programs at Vital Strategies, where he leads a team on improving health data, policies, and programs to address issues such as alcohol policy, tobacco control, among many other things. Dr. Karpati, it's a pleasure to have you to moderate this next session. Over to you.
Thank you so much. It's a pleasure to be here, and good morning, good afternoon, and good evening to all. We're now going to welcome our distinguished panel for discussion of alcohol, public health, and artificial intelligence in healthcare. We'll get into the technology behind PAHOLA, why this type of tool is so important, and how it's going to be used. I'd like to begin by framing this work in the context of the global effort to reduce the health harms of alcohol use. The World Health Organization has published a set of interventions that all governments should adopt, which are the highest priority evidence-based strategies to reduce the health harms of alcohol use. The package of interventions is called SAFER, and I encourage you all to learn more about that on the WHO and PAHO websites. 4 of the 5 strategies of SAFER are around broad policies around taxation and access and marketing of alcohol and drink driving. But the 5th intervention, the F in SAFER, is facilitate access to screening and brief interventions and treatment. It's the strategy most focused on assisting individuals with reducing their alcohol consumption. And the availability now of PAHOLA is a significant contribution to expanding access to individuals for such assistance. And we're really fortunate to have an expert panel now to talk about this, and I'll introduce them to you now. And just a reminder again, as Silvana said, to put your questions into the Q&A feature at the bottom of the screen. So we have 4 distinguished panelists. First, Erica Lloyd. She heads up the healthcare and education sector for Soul Machines and has been the lead for the PAHOLA as well as the Florence Project. Her goal has been to bring the scale and personalized user experience benefits of an empathetic digital workforce to PAHO and to WHO. Soul Machines have created a world first in humanized artificial intelligence, a human OS platform containing a digital brain that leverages cognitive models to perceive, understand, and connect to users in a way that humans do. Erica's background is in technology, science, and innovation ecosystems. Our second panelist, Dr. Maristela Montero. Dr. Montero has acted as the senior advisor on alcohol at PAHO in Washington, D.C. for 18 years, after nearly 10 years of coordinating the program on substance abuse at the World Health Organization in Geneva. Dr. Montero is responsible for technical cooperation with ministries of health, universities, research organizations, civil society organizations, and collaborating centers of PAHO WHO on topics related to alcohol policy, research, and capacity building in all countries in the region of the Americas. Third panelist, Dr. Jürgen Riem. Dr. Riem is senior scientist in the Institute for Mental Health Policy Research and in the Campbell Family Mental Health Research Institute at the Center for Addiction and Mental Health in Canada. He is professor and was the inaugural chair of addiction policy in the Dalai Lama School of Public Health at the University of Toronto, and he also holds professorships and positions in Germany, Spain, and Russia. Dr. Riem has been a leader in generating and analyzing the scientific data needed to inform clinicians and policymakers of strategies to reduce alcohol, tobacco, and other drug attributable harm. Last, Dr. Kevin Shield. Dr. Shield is an independent scientist at the Institute for Mental Health Policy Research and head of the World Health Organization PAHO Collaborating Center in Addiction and Mental Health at CAMH in Canada. He is also an assistant professor in the epidemiology division at the Dalai Lama School of Public Health at the University of Toronto. Dr. Shield's multidisciplinary public health surveillance research programs generate scientific data that inform individuals, clinicians, and policymakers on how best to reduce the public health harms caused by alcohol and other drugs. So with that, I welcome our distinguished panel, and we'll engage in an exciting discourse about this new tool, how it fits into the global landscape, and particularly in the Americas, and how the new technology really will serve to expand access to care, access to services for people around the world. So first, I'll turn to you, Maristela, and ask if you could tell us a bit about how and why did PAHO decide to develop this tool?
Thank you, Adam. First of all, I think COVID brought up to the front some of the key issues that always haunted us in public health in the alcohol field. About 50% of all the information in the internet is misleading, is false, and it is very hard to distinguish what is good or bad information. And with COVID, people relied a lot more on the internet and social media for information and misinformation, and leading to serious consequences. And the other was the limitation of the services, and that are chronically understaffed. Professionals are overwhelmed, especially in primary care, and with more and more duties to do. So if we can improve the way that they receive the information, and with artificial intelligence, I think it is a great step forward. And so we decided to try out and launch PAHOLA.
Thank you. Now, maybe, Erica, we can turn to you, and if you could explain to us a little bit about how the technology actually works.
Thanks, Adam. Well, you've seen the incredible CGI in PAHOLA. It's sort of movie-grade quality CGI. So our technology makes up two component parts. One is that the dynamic, lifelike CGI you see in the character. And the other part is what we call a human OS, which is our platform that contains a digital brain. The digital brain animates our characters. So PAHOLA is animated and live, if you like, autonomously animated and live in the same way that we are when we talk to each other. So her responses aren't scripted. The emotion that she displays is driven through interaction with the user. It's the first in the world, by the way, that we're the only ones that do this.
Could you expound on that and put this approach that's being applied for alcohol into the larger context of behavioral health, mental health, substance use focused AI tools?
Absolutely. And there are three really important component parts here. What I've heard today is the word judgment-free. So health conversations require a suspension of bias or judgment to be impactful. And we know that people or users don't feel stigma or don't feel societal judgment when they engage with a digital person or a digital health worker. So that gives them a benefit of anonymity and a safe space in which to seek information or treatment. There's no dumb question. There's no embarrassment. So that's one of them. The other one is the empathy that occurs. So you can get great information off a website or a chatbot or something, but it's a one-way communication channel. It's you reading it. The chatbot is giving you a transactional information, both useful, but we call them cold. If you want warmth or human-like interaction, the empathy is provided in the two-way human-like interchange gives a couple of benefits. One, the experience feels very personalized, which is great for people. Two, it provokes in humans a limbic system response, if you like. So you feel connected, and when that happens, different parts of your emotion and your brain are switched on. You can retain more information and you can do it for longer because it's been a two-way interchange. The third one is scale, which, as we know, the scale of the unmet needs we're all talking about is vast. So when you have limitless scale and multiple languages and digital characters that can look and feel like the people they talk to, you can get a deeper connection to more widely spread your information, your accurate, signed off public health advice.
Thanks so much. I'll make a note. We're going to continue with some questions for the panelists. And I know that many people are putting questions into the chat, and we'll have a chance to respond to those questions or towards the end of our discussion here. Turning to you, Jürgen, could you just build on excuse me, some of the comments made around the current context, the COVID pandemic, Maristella made reference to this earlier, and others have as well. How is the need and really the opportunity also for digital tools for mental health and substance use in particular been affected by the COVID pandemic? How is the current context creating that need and that opportunity?
Well, in a nutshell, the COVID pandemic has highlighted the need for healthcare workers. Not only was there more need due to the pandemic, the rates for mood disorders increased, the rates for seeking health services for any kind of mental disorders or symptoms increased. But also, due to COVID, in the first 15 months, only 115,000 healthcare workers died. And this was exacerbating the significant global gap of personnel, which already existed before the pandemic, especially in lower resourced countries. Finally, COVID, with all of its impossibilities for personal interaction, stressed the need of effective non-personal forms of communication, of virtual forms of communication. So overall, COVID clearly accelerated the development of PAHOLA.
Thank you. And I do invite any of the other panelists, of course, feel free to respond to any of your colleagues' statements. Maristella, yes, you wanted to build on that?
Just to add that, compounded to that was people staying home, and then all the alcohol sales also moved from being a public social enterprise, so to say, to being going back to the homes of people, and with home deliveries, and again using social marketing and the internet to promote alcohol, and this led to policies going backwards. And this is a great concern for us, not only at the individual level, but at the public health level, that because we know we need to reduce the availability of alcohol, either economically, socially, or physically, to improve public health.
And to that point, Maristella, if alcohol is being delivered to the home, then care and health information and enablement tools should be delivered to the home as well. And I guess that's part of the thinking here, isn't it?
Mm-hmm.
Let's go a little bit deeper then. Erica had begun to explain some of the underlying AI principles of PAHOLA in a general way. Jürgen, may I ask you to provide some more detail on the underlying approach that PAHOLA takes in its interaction with the users? That is, what's the underlying psychological or behavioral science model that PAHOLA is using?
Well, it is not only, of course, the AI. The AI only enables you to use tools, and the tools PAHOLA uses are similar to the tools human professional healthcare workers would use. And the most evidence-based, or one of the most evidence-based approaches to change behavior is the cognitive behavioral therapy. That's a psychosocial therapy, which was originally developed to relieve and to change behavior, which is underlying depression, to change cognitive beliefs and thoughts, to regulate the emotions, and to establish coping mechanisms. For a lot of behavioral change, you not only need to see what is the current status quo, you also need tools to go to the next level, to a different level. And CBT, cognitive behavioral therapy, has been underlying successful behavioral change in a lot of mental disorders, but it has been also used to other disorders like sleep disorders, hypertension, and the underlying reasons of overeating. So PAHOLA is completely innovative in the AI side, but is based on established evidence-based principles on the intervention side. And I think the combination is necessary. You do not only need the AI side, you also need the theoretical principles and the evidence-based therapeutic principles in order to change behavior.
Thanks for explaining that and how that rigorous approach on the therapeutic side is connected and combined with the new innovation, but it's ultimately based in proven strategies and proven approaches that we know can help people in very practical and real ways. Maristella?
Yeah, just to complement that, in the field of alcohol included, WHO for 40 years has developed tools and a motivational approach and to provide brief advice. It has proved in clinical trials all over the world. There are many thousands of papers, I would say, by now on brief interventions for alcohol. And one of the key challenges have been to turn into a routine practice in primary healthcare and non-specialized services. It is just a lack of time and is the variation of the attitudes of professionals, the stigma that without intention sometimes they do in their in the tone of voice, in the way they talk to the patient or the client, that prevents them to opening up and not wanting to talk about their problems.
So just can you build on that? Can you tell us a little bit more about who's the target audience, if you will, for this? Can you just describe some typical users or who may benefit from accessing PAHOLA?
Well, we programmed her, or we built her to reach anyone who has interest in alcohol-related issues, because she provides reliable information on dozens of topics about alcohol in cancer, about alcohol in pregnancy, breastfeeding, sexual performance, fitness levels, you name it. It is really not just for those with a drinking problem. So it can help if you know someone with a drinking problem you don't have, how can you help that person? And those who want to assess their own risk, know, are they drinking too much or not? And they can do that. And PAHOLA will tell if they are at a risk that requires a reduction in their consumption. And if they're ready, they can follow her steps for making a plan, understanding their behavior and triggers, and move on into a concrete plan to reduce their drinking. Finally, she also recommends additional resources. We know some people with more problems may need face-to-face treatment, may need even inpatient treatment, and we compile free resources and or helplines or links to Alcoholics Anonymous and other self groups, country by country in the region, and people can go to that and find immediately some level of help.
Well, thanks for emphasizing that. So PAHOLA, as it is deployed in different countries, will be integrated into that local context, and that those connections are made to, when necessary, to referrals and connections in the local context. I think that's a very important point to mention. Thank you. Turning to you, Kevin, could you tell us a little bit about how are we going to describe and to know the impact of PAHOLA?
So currently, PAHOLA is completely private in terms of its information. Although you're giving PAHOLA information during your session with PAHOLA, she's not storing any of that information long term other than during the conversation. So it's completely private. However, to complement PAHOLA, we're doing studies on the side to improve PAHOLA, testing out various different methods of treating alcohol use disorders and harmful alcohol use and tracking alcohol use over time. But that's separate from this app, which is using those information gained from those separate studies to better treat alcohol use disorders and harmful alcohol use through this app.
We've heard that this entire field of digital tools to support mental health and substance use disorder care is really a exploding field, and it's one where, because of the limitations of scale that are well described, is really exciting and has the potential to transform the field. Can you talk a little bit about how the experience of PAHOLA's rollout can inform wider efforts to scale digital tools for behavioral health?
So this is a really good question. The explosion of digital interventions has been vast, and it's, so to speak, the Wild West. We don't know what works and what doesn't. And PAHOLA is grounded within specific therapies that we know that works. But we're also complementing that with scientific studies. Not, if you use this app, you won't be included in those studies. It's separate from that. But to test the validity of PAHOLA at decreasing alcohol consumption. So we know from those studies that she's working well. And those studies will feed back into the app to improve PAHOLA. But if you use this app, it will be completely anonymous. So we don't know whether or not you've reduced your alcohol consumption, but we hope that you do by using the app.
Thank you. Jürgen, you wanted to come in on this?
Just one sentence about the principles, how evidence will be gathered on the effectiveness and cost effectiveness of PAHOLA in the future. We will be using the same methodology, the same designs which are used and which are prescribed by most societies when testing pharmaceuticals. We will be setting up a randomized controlled trial to be absolutely sure that it's not only based on evidence-based theories, but it actually works the way it is intended. And so you can think about the next years of rolling out a research program which will further manifest the capabilities of PAHOLA.
Thank you. And again, I just think that, this is such a critical need, the need for expansion of services, expansion of access to people for services around mental health and substance use is so vast that, to your point, Kevin, identifying the most effective, the science-based tools to do that is so important. So, Erica,
Adam, if I may, sorry,
yes,
just to
please.
comment on the end of that one is, I understand there's been something like 300,000 new wellness and mental app type apps have appeared and emerged in the last sort of 2 years, 18 months or so. And I think this speaks to two things. One, technology's role in bridging the gap between resources and unmet needs. But the important one that's been discussed here is when to do that when standing firmly on science. And I think that space, to Kevin's point around the Wild West, is the perfect function of this group here assembled with technology and correct CBT and then rigorous trials. So we're really excited to be part of seeing what's happened next. Sorry, Adam, you were about to say something.
I was about to just turn to you for, you mentioned it before and others have touched on this. Can you just clarify for everyone the privacy and confidentiality aspects? This is an interaction between an individual and this digital tool, how can individuals be confident that that interaction is completely private, completely confidential?
It's a bit like the A in AA. I'm going to talk about that bit of it. So if I'm the digital person and you're the user, when you go in to engage with PAHOLA, you will click a form which says that your camera and audio will go on so that you get the rich experience. But the digital person, so PAHOLA can read your face, not your actual face, but the 16 points on your face, which means she can track and assess and respond to your emotion. So that is happening as a video web stream. No information in that interaction, which is an autonomously animated, a live conversation that goes back and forth, is stored to disk. The data that Soul Machines collect is anonymized and is around the caliber or the EQ dashboard we produce of the interchange. No data is collected. It's all anonymized. So that's essentially it. So people can feel 100% secure. There is no facial recognition. There's no storage of IP addresses. It's completely safe and anonymous.
Thank you. Last question. What's that?
It's very important, particularly when you want to provide the safe space for people who may be vulnerable or fear seeking help or struggling.
Absolutely. And it's again, back to some of these earlier themes. It's the same principle that applies in human interactions around knowing people can be confident in those interactions. Maristela?
Just to complement that, people accept both the privacy policies of Soul Machines and of PAHO. We also are involved in this. We take responsibility, and therefore it is completely compliant with the policy of the organization.
My last question to you, Maristela, is just if you can give us some bigger context on how PAHOLA fits into other efforts of PAHO that's related to alcohol policy and interventions.
Well, as Silvana mentioned earlier in the beginning of the webinar, we launched the first ever alcohol campaign, educational campaign, or awareness campaign in the region that is still being rolled out until the end of the year. In terms of technical cooperation, we have been working for many years in supporting countries in pass the policies that will make a difference, and then we joined WHO in the launching and the dissemination of the SAFER initiative that, as you mentioned, it has the 5 most important, most cost-effective or effective interventions. We have also stepped up the work on health taxes, alcohol taxes, that is still expanding. We're doing collaboration with other units, and it included also WHO, other regions. So we continue to promote the need for these policies. Without governments adopting these important policies, we will not make that much progress. And we recognize we cannot just count on individuals to change themselves, like, for example, with PAHOLA, but it is a great tool that can help people see differently and change the norms and acceptance of alcohol as a healthy behavior. It is not, and people need to realize that.
Thank you. Kevin, you wanted to have a last word?
Yeah, so a lot of what the WHO does and the Pan American Health Organization focuses at the population level. So increasing alcohol taxation, reductions in availability, and reductions in marketing, so marketing bans. What PAHOLA does is she's targeting one of the WHO's and Pan American Health Organization's key targets of increasing treatment coverage for harmful alcohol use. Doing so is actually extremely difficult, especially in developing societies, which don't have the resources needed to train. And when they do have resources, and when they do gain those resources, it's not immediate. It takes a lot of time to train healthcare workers and deploy them where they're needed. PAHOLA helps us leap this hurdle quite well because she's low cost and she's infinitely scalable. So we can increase access to treatment for harmful alcohol use to numerous people across the Americas, especially for a lot of people who traditionally wouldn't have access to that treatment.
Right. Well, with that, I'm going to turn it back to Silvana. We have a lot of questions coming in the chat, in the Q&A. And we'll try to get to as many of them as we can. And so thanks to the panelists for this discussion, but a lot more to come. So Silvana, over to you.
Great. Thank you very much, Adam. And thank you to our panelists of experts, Erica, Jürgen, Kevin, Maristela. That was really enlightening around all the information you've shared about the tool itself, but about how AI can be applied to help reduce consumption of alcohol. And we have a very active participation from our audience of over 450 people putting in their questions and answers in the Q&A icon. I encourage those who haven't yet done so to please do so. But I've kind of started pulling together a few of the questions that I would like to pose back to the panelists, just to extend this panel discussion a little bit more and to have it as an interactive session with our participants, as interactive as a webinar can be. So the first one, there were several questions about the tool itself. And I'm going to direct this to Erica. So there are questions about Florence versus PAHOLA. Is it the same platform? Is it different? Florence, of course, is the WHO tool to assist with tobacco cessation. PAHOLA is the AI for alcohol use reduction and misinformation on alcohol risks to health. But if you can comment on PAHOLA versus Florence in terms of platform, but also there was questions about why is it all female names? And was there any research on that? Erica?
All right, let me start. I love Florence dearly, and we launched her last July, and PAHOLA today. So there's an 18-month lag, and in between time, Soul Machines has upgraded our human OS platform. So PAHOLA has a little more and more movement and gaze, more interaction, more range. We will be upgrading Florence with WHO shortly. In fact, she's about to be reissued, containing all WHO's vaccine content. So the point that Maristela made earlier around misinformation, we will see that there. As far as why she's a she could be a they or anything else. Maristela's team chose PAHOLA's look and feel, and she is divine. But one thing we know is that, I don't know the answer to why, but people prefer information and to do with care and healing from a female character. CBT therapies, slightly more from a female character. So if it works, let's go with it.
Excellent. Thank you, Erica. There was also a lot of questions about the level of advice that PAHOLA provides on alcohol. Maristela, I'm going to ask you if you can maybe comment on how personal does the advice get? Can we link it to actual treatment services or helplines in the country itself? And is there a sort of continuous follow-up care so that once you visit, if you go back, PAHOLA will recognize you and be able to carry on? So if you can comment, Maristela, on advice.
The advice is personal and is based on the level of risk of the person, but it is a single session of advice, which, by the way, has also been proved in clinical trials before to work, to be effective. But because PAHOLA is anonymous and the interaction is anonymous and confidential, the next time you engage with PAHOLA, she does not know that you are you. So you may need to do the assessment or give her your score on the audit for her to ask you questions. And this is important because PAHO as an organization, we are not healthcare providers. We do not provide medical care. per se directly, and we don't want to get that perception. But as countries admit, are interested in integrating PAHOLA, and as we learn more, this will be possible at country level following ethical recommendations of the country and the ability to have more than one engagement with her. I see Kevin wants to.
Kevin?
Yeah, so this is a great question. So I just want to go into a little bit more depth about the level of advice that she can give and the personalization of that advice. So right now, PAHOLA is launching, but she's also a digital human who can learn over time. So right now, she provides a basic level of advice, and she'll get better with each interaction because she's learning from each interaction. Also, I just want to mention again that we're doing randomized clinical trials in parallel, testing out various techniques with PAHOLA to see how we can improve that advice. So right now it's based in science and we know it's effective, but we're trying to improve that effectiveness over time through these randomized clinical trials as well.
Okay, excellent. And Kevin, while you have the floor, there were a few questions coming in around how this tool is used in different life stages, right? So with adolescents especially versus say an older adult, I don't know if you've already collected information on that or you plan to study that a little bit more, if you can reflect on that question.
So right now, PAHOLA asks about your age and provides a general treatment plan from harmful alcohol use. As we go forward, we're going to customize PAHOLA to different ages, but that needs to be based on randomized control trials, and we're just not there yet.
Okay, great. Thank you, Kevin. And just on that topic, oh yeah, Maristela, did you want to add?
Just to complement that, for people who are under 18 years of age, PAHOLA actually says that she was not programmed to give advice to them, but if they want to continue, she would be happy to talk to them about it, because really the scores and the risk that is behind her programming is for adults.
Yeah, excellent. Thank you. And you're gonna, I see you have your hand up, and I had a question that I was going to direct to you from all the questions coming in around science, around the effectiveness of AI to change behavior and how the science really backs up PAHOLA. So if you can comment on that as well as your question or comment that you're going to provide. Over.
Okay, two things. First, what can be learned in the assessment PAHOLA is already using? It is not only the concern of the individual with drinking, there are also 3 specific questions about the frequency, the quantity, and the heavy drinking occasions.
Okay.
And further advice in the future can build on those specific patterns. The second question about what we know of AI or such tools, there are meta-analysis of those tools. And obviously, there's a huge variability. We have several 100,000 tools, and you cannot assume that every tool works. But we know that the better tools, and PAHOLA is evidence-based and will be one of the better tools, have a very strong support for overall behavioral change. So the meta-analysis on those theory-based tools are actually quite promising.
Excellent, excellent. Thank you. So, you know, there are many, many questions in the Q&A. We cannot, unfortunately, get to all of them, but I think one of the most popular questions was, how can I access PAHOLA now? So to help answer that question, I am going to turn back to Dr. Anselm Hennis, the Director of the Department of Non-Communicable Diseases and Mental Health, to give us more information and to close off this session. And I thank everybody for their participation. Back to you, Dr. Hennis.
Right. Well, thank you so much, Silvana. Thank you to the panel, and thank you to everyone who's joined us today to meet PAHOLA and learn about her role as PAHO's first digital health specialist in alcohol use. And of course, I wish to thank our esteemed speakers and panelists who shared their time and expertise with us today, particularly the leaders of WHO and PAHO, Dr. Tedros and Dr. Barbosa, on behalf of Dr. Carissa Etienne. I also want to thank Dr. Karpati, Dr. Luciani for guiding us so skillfully through the event. And of course, our panelists who shared so much of their expertise. And I wish to acknowledge Soul Machines also on Rooftop in terms of the development elements of this entire process. It was indeed a really significant and committed labor of love to bring us to this state. PAHOLA's launch is an important milestone for PAHO and WHO, as she is our first digital health specialist to focus on alcohol use, and she represents a cutting-edge innovation in the use of public health expertise and artificial intelligence technology designed to improve knowledge, promote health through personalized, non-judgmental engagement, and ultimately to save lives. We hope that this innovative approach to health promotion can serve as a springboard for future digital health initiatives. And you've heard about the significant capacity being developed globally, but as one of our panelists said, it's almost like the Wild West. You need to have it based in evidence with the ability to monitor and follow what is happening. So basically, in this space, we hope that this can lead to a better understanding of how this technology can help us in our pursuit of healthier populations and our overarching goal of health for all. PAHOLA's success depends, as you've heard, on us making use of her, consulting her, and also contributing to her improvement. Any new model based on machine learning and artificial intelligence learns and improves from interacting with users in a dynamic and incremental process. So I call on each of you to contribute by interacting with PAHOLA and providing constructive comments that can help us better serve you and the many people in need. And I'm sure that you are, as I'm also, eager to follow PAHOLA's progress in the months and years to come as artificial intelligence continues to evolve and as we continue to gain deeper understanding of how this type of technology can best serve health providers and service users. I would like to offer my heartfelt thanks and congratulations to all who have been involved in this remarkable work, culminating in the development of PAHOLA and today's launch, particularly recognizing the technical design expertise, as I said before, by Soul Machines and Rooftop. Thank you once again for taking the time to participate in this event. We're grateful for your enthusiasm and interest, and we hope that you will engage your networks of friends, family, and colleagues to spread the word about PAHOLA. We spoke also about the links, and I'm sure that as we close the session, we will share the link with you, and we hope that you will log in, interact, engage with PAHOLA, and spread the message. With that, I wish to thank each and every one of you again, personally and professionally. And I conclude this session. I wish everyone a safe and healthy weekend. Thank you so much. Thanks to all of you.
Thank you. Thanks. Bye-bye. Thanks.